Hello, everybody. It's October the 13th, Wednesday. Considering how many deaths we had to read through the other day, and it's an honor to pay tribute to these great people. But you hate it. You just hate like crazy losing these people. Today is not nearly as bad. We have 22 additional deaths, which is terrible. But at the same time, it's not like it was the other day. The other day we had 110. And so if you could join just in prayer for all these great people as I read through this and everything, please keep them in your prayers. The 3,977th death is an 80-year-old male from Putnam County. The 3,978th death, a 52-year-old male from Mingo County. The 3,979th death, an 81-year-old female from Lewis County. The 3,980th death, a 66-year-old male from Putnam County. The 3,981st death is a 72-year-old male from Preston County. The 3,982nd death is a 63-year-old male from Randolph County. The 3,984th death is a 46-year-old male from Preston County. The 3,984th death is a 90-year-old female from Preston County. Then there's that is the eight deaths that we had that were recorded yesterday. We have some reconciliation deaths, 11 of those. They were the 3,985th death, a 79-year-old female from Marion County. The 3,986th death, a 72-year-old female from Hancock County. The 3,987th death, a 95-year-old female from Cabell County. The 3,988th death, a 44-year-old female from Cabell County. The 3,989th death, a 78-year-old female from Wood County. The 3,990th death, a 65-year-old male from Wyoming County. The 3,991st death, an 84-year-old male from Brooke County. The 3,992nd death, a 57-year-old female from Wyoming County. The 3,993rd death, a 59-year-old male from Doddridge County. The 3,994th death, a 62-year-old female from Fayette County. The 3,995th death, a 77-year-old male from Kanawha County. And today, the deaths that have come to us today are a 3,996th death is a 46-year-old male from Preston County. The 3,997th death, an 84-year-old female from Preston County. And the 3,998th death, a 90-year-old female from Preston County. Please keep them in your prayers. I want to show you some charts in just a few minutes, but let me give you some numbers here. We're down under 10,000 cases that are active right now. We're at 9,703 cases. That's down 858 more since my last briefing. We have 1,130 new positive cases. Our daily positivity rate is, thank goodness, under 10% now, and that's way still too high. It's 8.2%. Our cumulative rate is at 6.03. We have 242,000 plus people that have recovered from this in West Virginia. We have 829 people that are hospitalized, 239 that are in the ICU units, and 175 that are on ventilators. All that is significantly down, but it's still high. About 80% of those that are hospitalized now are unvaccinated. We still are running about 20% that are fully vaccinated, and that in itself is a concern as well. We do have 2 green counties, and we've got 57 outbreaks in our school community. We're down to 577 confirmed cases there. We have 2 counties, Pocahontas and Tucker, that still don't have a mask mandate, but 53 do. Let me show you these charts now. the number of active cases in West Virginia got up to 29,744 active cases at one time. You can see that peak, and that peak happened on September the 16th, I think, maybe September the 17th. And you can see how that has fallen and everything. All the way across this, we're looking at the Delta variant peak of active cases at 29,744, and today we're at 9,703. So nevertheless, we've dropped from 29,000, almost 30,000, down to 9,700. Also, in that same time period, if you'll look at September the 15th, and General Hoyer called this date, so I guess we'll have to put up with him on that a good bit. But 1,964 was the number, the case studies that we have at that point in time, and you see through that how we've dropped each and every day, how we've come down, on those cases, and those are our active cases. Is that correct, Jordan? But you can see, and these two charts clearly show you the stuff that we look at each and every day, and they are showing you this Delta variant surge. They're showing you the peak of that. Not to say that we can't, jump back, because we don't know really and truly. We surely don't have that playbook that I've talked to you a bunch of times about. But nevertheless, that's good looking charts from the standpoint of it does show a peak, and it does show us coming down, and God knows we all want it to come down. There's a couple items. Last night I amended, the special session call to include 2 additional items. The first is a supplemental appropriation of $4 million that will backfill the Victims of Crime Act grants. These grants go toward providing direct services such as counseling, and court advocacy, personal advocacy, client transportation and support services to victims of crimes, and which include domestic violence, sexual violence, child abuse, and elder abuse. The U.S. Congress, in their infinite wisdom, and I don't say that flatteringly, but they have cut this funding. So at our state, we have one of two choices. We'll either just leave it out, or we'll backfill the dollars. So I sent up that we absolutely want to backfill the dollars, and we're, they fixed it over, but it will take, it'll take several years if we stay with where the federal people are at and everything. It'll take way too long, and that's why we're going to step up and commit this funding immediately, and this funding of many things. But this is really vital. We all know just how difficult and bad, all this can be, and it can affect not only our adults, it can surely affect our children, and so we want to step up and take care of it. The other that, we really need, I really need to go through this and read through this to make sure that we all understand exactly what we're doing. I sent a second bill up. It's basically a clarification, that any government or private businesses that wishes to mandate the COVID vaccine must also allow for exemptions, that mandate, for medical or religious reasons. I mean, that is the law of the land. And Just stay with me just 1 second so everybody can totally understand where I'm at. Where I'm at is just here. I absolutely firmly believe that this country is founded upon our rights and freedoms, and that's really the ingredient that makes America great, surely makes West Virginia great. Now, from the standpoint of telling our businesses what they can do in regard to mandates, we absolutely need our businesses to decide that. I have stood rock solid that I am totally against these mandates, but truly I stand behind the rights of our private businesses. All I am trying to say here is our private businesses absolutely need to comply with the law. And the law of the land is really simple. You know, there are medical exemptions, you know, and they ought to allow these exemptions, you know, but there are medical and religious exemptions, you know, and I'm going to read just a couple of, you know, other things. We need to be very consistent in any regard of mandates. You know, I am against the federal government telling our private businesses what to do. However, we need to follow the law of the land, and absolutely I'm trying to clarify that. This is a common sense bill because federal law already says you have to allow for these exemptions. Our military has mandated vaccines, however, they are allowing these exemptions to be claimed. Our own Attorney General, you know, Patrick Morrissey, has written a legal opinion which confirms that we absolutely must offer these exemptions. But we've all heard the stories recently about West Virginians being fired from their jobs for not taking a COVID vaccine. Businesses can mandate, they can mandate the vaccines, you know, but at the same time, they need to allow for these exemptions. You know, we are joining many other states that are trying to clarify this law, but we are not joining other states in restricting businesses from choosing what is best for them. This bill does not affect any of the other vaccines that we are currently mandating in our public schools, and it is only for COVID-19. These other vaccines like the mumps, measles, and rubella stuff and everything, been around a long time. It's weathered the test of time. You know, what we do not need to do is run out, even though I wholeheartedly support the vaccines. I will continue to absolutely encourage in every way for people to take these vaccines because I truly believe in my heart they are very, very, very safe. But they are absolutely, we should know that something that's been around as long as the measles and mumps and rubella, or mumps, measles, and rubella, you know, vaccines such as that, they have weathered a test of time that is a lot longer test of time than what we have tried to navigate our way through in this COVID situation. You know, so with all of that, I hope that this clarification will absolutely be taken as just that. It will be taken as what it should be. It is law. It is law that we respect people's surely medical situations or surely their religious beliefs without any question. It's law. And with all of this, you know, instead of us running into so many different headwinds that divide us in every direction, I'm hopeful that this is going to clarify. Okay, just some more cleanup stuff, you know, from the standpoint if you're 65 and older and you get any symptom at all, please get a test. We're waiting on you with the antibodies and everything, and they can save your life. As far as face coverings and everything, if you're in a crowd of people, a big crowd of people, indoors, and most people are going to be indoors before long because it is going to get colder and it's going to get nasty. But when it does and everything, and you're indoors and you're compromised, 65 and older or whatever like that, you've got some kind of lung condition or diabetes or whatever, you ought to really think hard about wearing a mask. All the booster shots, we're waiting on you. If you're 18 years of age and older and everything, we're waiting on you. I know a lot of people are coming and everything and getting your booster shots. We can lead the nation again right there, and I encourage you in every way to get your booster shots. We should be winding up or done with the nursing homes in regard to the Pfizer booster shot and everything, and that is an incredible accomplishment. And so We continue to do just what I said. You know, this thing doesn't have a playbook. We make the very best decisions that we can possibly make. We make clarifications and we run to the fire. You know, we aren't sitting here in a popularity contest. We're trying to make best decisions that we can make for all and run to the fire and try to do everything we possibly can to try to shut this thing down and help in any way we can. We have 65.7% of our people now that have one shot. We have 81.1% of the 50 and older that have one shot, and 91.2% that are 65 and older with one shot. Still, the people that are dragging this thing down and everything are younger people, and young people, listen to me. When it really boils right down to it and everything, you've listened your entire life. You've listened to your doctors, you've listened to your mom and dad, you've listened to your grandparents. 91.2% of your grandparents are vaccinated. Listen to your grandparents. 81.1% of your parents are vaccinated. Listen to your parents. We need to get you across the finish line. We don't want bad results for you, and you can really help us here. Now, we gave away, a couple things and ended up round 2 of Do It for Baby Dog. I'm going to show you something here in just a second, but Steven Stover of Mascot, got an incredible zero-turn 61-inch mower and everything, and God, oh goodness, I hadn't seen that picture, but you can see Baby Dog's trying to drive it, and she always makes us at least get a smile on her face. And the thing I love about it is just this, is she makes people smile and she loves everybody. Now, at the end of the day, you can say anything you want, but shouldn't that be what we're trying to do when we're trying to get people vaccinated and across the finish line? Shouldn't we be telling them all that we love them? We love them all, and that's what she does. And shouldn't we some way, somehow put a smile on their face and, and the hope that maybe that they understand better that the more that we get vaccinated, the less people will die. Ashley Dingus of Scott High School. We were at Scott High School, and it's just fabulous. I mean, they were all out at the football field, and, those kids were just unbelievable. And, all the administrative people and, all the, just the superintendent, the principal, all the teachers and everything. I mean, it really and truly, not to take anything away from any part of the state, but I'm going to tell you right now, you go somewhere to one of these schools in the southern part of the state, oftentimes they feel like maybe they've been left out just a little bit and everything, or they've gone through surely a tough go of it and everything, because a lot of businesses have left and everything. We're trying to bring back, and those kids were just wonderful. So we congratulate Ashley and her family, and we salute all those kids at Scott High School. Then we went to Hurricane High School in Putnam County, and Connor Reese, was a recipient of a $100,000 scholarship, as Ashley was at Scott High School. But we were at Hurricane not long ago, and I can tell you this without any question. That school is spectacular. And I just think that they're just doing a lot of great stuff there, and I couldn't be more proud than to go there. Just a great family, great young man, and we were there and gave away, I think, a scholarship, about 2 weeks ago there. So that, and I think there's been three of those scholarships in Putnam County. I think at Poca and Hurricane 2 different times. I think that's right. But and then we left there and we went to the middle school. We went to Andrew Jackson Middle School. And Carly, is it Baisden? I think that's right. Lo and behold, we really surprised her and everything. She didn't know it was coming and everything, but she also was a big winner. And then a kid that was there, you know, that in week 4 also won, you know, the same thing. And so Sam Smith and Carly Baisden, you know, we congratulate you and we thank you. And again, what a school. You know, if you haven't been in the schools across the state of West Virginia and you've not seen really what's going on in those schools, really and truly, if you have this notion that, you know, our teachers are not doing, you know, their job, or the schools aren't any good, you know, and you know, or maybe the administrative people could be coming up with a whole lot better decisions, you need to go to a school. You need to go to a school. You see, I'm in and out of the schools all the time, and I know what they're doing. You know, I know there's no question that we can probably do better in some areas. We always want to try to do better, but I'm going to tell you this. If you don't believe it, you go to a school. I'm telling you, you'd be stunned. You'd be stunned how clean they are. You'd be stunned really and truly just how good the love for those kids and how hard our teachers, our service personnel, all the administrative people, how hard they're trying for the kids. You would be stunned to see the love that those kids have for their teachers and all the folks at those schools. It's really good stuff. And you know, and I hate to say it, but no, I don't hate to say it. I can tell you, I am damn proud of what's going on in our schools, and we're getting better and better. And absolutely, all of us should absolutely just take note. They're doing a good job, and we just want it to get better and better. Vaccine eligibility, 12 and older, young people, you know, got to get more of you vaccinated. Grand families, need you. Wait a minute. Wait, stop. We've got a video they're just telling me about the ending up the second round on Baby Dog. I'll let them play that. So y'all go ahead. I haven't seen it either. Annie, you got to give Baby Dog a hug. And we're going to get through this, and we're going to look back on it, and it's just going to be a little blemish. It's a pain. It's really, really tough on all of us and everything.
It's astronomical to think that she'll get a full education and get to come out of college debt-free, and I just can't even imagine it right now.
You have won a 4-year scholarship, full ride scholarship, to any institution in West Virginia.
When I came around the corner, I saw the boat and still didn't know it until I saw Baby Dog and Gov Justice, and still kind of surreal.
I love it. I haven't had a new car since 2006, so I love it.
You got a pet baby dog. Thanks for getting vaccinated, thanks for registering, okay?
And I thought I was coming here for something else, and I'm glad that I got vaccinated, and I think it's really important for everybody to go out there and get vaccinated, and I'm really glad that I received this today.
This is definitely one of the more surprising days for me. I've never experienced something this generous.
Hey, Bruce, Baby Dog and I brought you a bass boat right here. Where here is Ashley Dingus. She just won a $100,000 full scholarship. Well, if that didn't make you smile, there's got to be something wrong with you. That's all there is to it in my book. But the bottom line of what we're doing there, and the federal government's been kind enough to give us those dollars to where we could do that and pass some dollars out, across our state and everything. And but the net of what you're trying to do is do one thing, and that is absolutely raise the awareness of getting vaccinated and absolutely achieve getting vaccinations out there. Well, in doing so, we have crossed way past 200,000 additional people since we started those campaigns. And there's no telling how many that we've saved lives. And absolutely without any question, nobody can dispute the success of the program. Now, do I believe every single one of those people wouldn't have got the vaccines, or would have got their, that all those people that would have gotten their vaccine or would not have gotten their vaccine, rather, if we hadn't gone out and done this? Well, of course not. A bunch of them probably would have gotten their vaccine, but maybe a bunch more wouldn't. And so with all of that, I couldn't possibly feel more pride in the fact of the success of what we've done, and we put a lot of smiles on a lot of people's lives. And so I continue to encourage in every way, all across our state. I continue absolutely to encourage everyone to get vaccinated. And we're going to keep at it. We're going to keep trying like crazy in every way to get more and more people across the finish line, because it'll save lives. Let me just say here where, just announcements, more announcements, is the vaccines, the testing rather is free in every way. You absolutely need to take advantage of it and everything. Any level of feeling bad or anxiety, go get a test. I encourage you about getting your flu shots, because the flu season is right on us right now. I absolutely want everybody, again, whether you are a renter or a landlord, to take advantage. Take advantage of these federal dollars. We've sent out like $47 million out of $200 million. That's more money that can flow into our economy in West Virginia. Absolutely, the multiplier effect of those dollars is absolutely very important to West Virginia. If you are a renter or you are a landlord and you can absolutely qualify to take advantage of these dollars, do it. For crying out loud, it just means more money in the hands of West Virginians. We got an announcement. We got good news, from FEMA that they're going to send us an additional $2 million, that's going to go towards testing on the higher ed areas. And our colleges and universities have really stepped up to the plate to make sure that we continue to test, and this money will reimburse them for a lot of work they've already done. And I want to thank especially, our higher ed folks and everything for the work that they've done in coordinating the testing and for identifying and securing this funding. That's $2 million more flowing into West Virginia. I keep saying it over and over because I'm a business guy, but the multiplier effect of these dollars is significant. So the more dollars we can have moving throughout the economy of West Virginia just makes us stronger and stronger and gives us the opportunity to do more and more stuff. The West Virginia Vax team. You might remember that back in April, I announced that college students, in particular those qualifying in the health fields, were coming together to help administer vaccines in communities across West Virginia. There's some really great news. This project, known as WV Vax Team, has been recognized nationally for their great work by the Association of Schools Advancing Health Professions. I would like to congratulate and thank everyone involved, especially more than 1,000 students who came together to serve our communities when we needed them the most. So thanks so much to all those that did all that great work in getting out and serving our communities. That's the West Virginia Vax team. Way to go. Recognized nationally, absolutely. You surely should have been, and we are so proud of you. You know, today I am, this is an appointment to the Secretary of Administration, you know, and you know, but today I'm appointing Mark Scott as our new Secretary of Administration. And Mark is currently the president of the Randolph County Commission. He retired after 27 years from the insurance business, in an extensive insurance business that he had in north central West Virginia. And his appointment will be effective November the 1st. You know, I've had many conversations with Mark, and Mark is a very qualified man, and I'm really confident he's going to bring some real ideas and real juice to the situation, and we'll do a wonderful job. You know, so you know, Alan McVeigh was great and everything. We still retained Alan, you know, as our insurance commissioner. Alan continues to do fabulous work and everything, but Mark will absolutely just jump right in, and I'm sure he'll do absolutely terrific. Now, okay, you know, they from time to time they send me little notes and everything. It's just popped up here. It says, this is from Kathy, our First Lady, and she said she just saw the baby dog video, and she just wanted to tell everybody how much she loved it and how much she wants everybody to get vaccinated. So that's really good. You know, there's an art exhibition and everything, and that is every year we hold the Almost Heaven Governor's Art Exhibition, and it's time again, you know, that we go again. It's for kids K through 12 to participate. You know, from the standpoint of myself, the West Virginia Department of Tourism, the West Virginia Department of Arts, Culture, and History, we're inviting all those students, you know, to show off their talents, basically. The deadline for submissions is December the 6th, Monday, December the 6th. This year we are calling for a one-of-a-kind postcard design that depicts the theme, what does America's newest national park, the New River Gorge National Park and Preserve, mean to you? I mean, this is America's newest national park. It's right here in West Virginia on the great New River, and you know, I'm sure these postcards will be phenomenal. And so awards will be given to the first and second and third place winners in all three categories, from elementary school to middle school to high school, and winners will receive you know, just everything from $150 and $25, you know, gift cards and everything. So, and they'll be at the Blick Art Materials gift cards. And so get involved, show yourself off, show your talents to all of us, and we can't thank you all enough. That's all I got right now. Thank you all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. Just a few brief comments. As the governor noted, our new cases have come down fairly precipitously, which is really good news. We know, however, that the hospital numbers, while improved some from our high that we experienced during this surge, are still quite high. And we want to make sure that people are doing a good job in protecting themselves. As the governor said, about 80% of the people in West Virginia hospitals are unvaccinated, leaving about 20% fully vaccinated, which are generally older, more ill West Virginians. So make sure that you take advantage of a booster vaccine if you are eligible and have taken Pfizer and are 6 months out from your last dose, over 18 years old. Many criteria that could be filled by almost every West Virginian over 18 years old that falls into that category, and that the Food and Drug Administration are going to hear Moderna and Johnson & Johnson's request for also having approval for booster vaccines, which will be this Thursday and Friday. And then the CDC will meet the following Wednesday and Thursday to give their more final recommendations. So that's going to be an important part of what we can offer in our armamentarium. New study from Israel demonstrated that when we look at people getting Pfizer vaccines, that men start to lose the potency of the vaccine related to antibody levels faster than women do. People over 65 lose it faster than younger people, and people that are immunocompromised, as will be expected, also lose that, that potency faster. So really important for people to pay attention and to continue to uptake those third vaccines. We are also going to hope to find eligibility increases for our children, particularly our children 5 to 11. That application from Pfizer is going to the Food and Drug Administration the last week in October. And as we look at our hospital numbers, despite seeing a really large number of cases that we've seen during this surge be in children, and as we mentioned, the last press brief data is out now suggesting that children and adults equally can spread and catch COVID-19. Children under 18 tend to be more likely asymptomatic than adults who are over 18. But we also note that the good news for West Virginia is, although we do have a few children that have gotten sick enough to be hospitalized, today it's only 6 children in hospitals, 3 children in ICUs, and 2 children on ventilators. So we want to make sure that people continue to be very vigilant about making sure children are also immunized, because they're an important part of the transmission of COVID-19 in West Virginia. And also we're worried about the impact of long COVID, long-term side effects from COVID-19, which can happen, which can occur in up to 33% of people who are 3 to 6 months after their infection. But the good news is we're not seeing the severity that we've seen in some other states. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just to highlight a couple of efforts that continue to go on. As Dr. Marsh pointed out, we are waiting for updated data on Moderna and Johnson & Johnson. We are doing the background preparation coordination that needs to be done with facilities across the state, such as our nursing homes. As we mentioned before, 75% of those facilities use the Moderna vaccine. So they are all paired with the appropriate providers and ready when that approval comes. We continue to work the antibody issue. People need to understand this is a national supply chain and production issue with the Regeneron produced by AmerisourceBergen. And we get as many of those doses as we are able to get. We continue to get more of the intravenous version of the antibodies, but I just want folks to understand they should not be relying right now on that as their sole means. As the governor pointed out multiple times, every time we come on this press conference, the best tool we have is the vaccine. We do see continued uptake in the vaccine numbers. 18 years and older, 67.3% have had at least a first dose. And in our total eligible population at 65.7%. Also, just to reinforce of both what the governor and Dr. Marsh pointed out, while our case numbers are going down, we know that we have a plateau that historically exists with hospitalizations. And in the case of this surge, embedded in those hospital numbers is a significant increase in ICU and ventilated patients. So we continue to have that. We continue to work with our hospitals and our challenges. I want to thank personally Dr. Amjad and the National Guard and our Veterans Assistance Office for the work that they are doing to care for our patients at Clarksburg who are impacted by COVID, and supply of antibodies has been pushed to those folks. And thanks Dr. Amjad and the team for putting the extra effort in to take care of our veterans. Thank you.
All right, thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. I just wanted to add that on our website, vaccinatewestvirginia.gov, it does list the COVID vaccine sites across the state, and those sites also were updated the other day that offer flu vaccines. So when you're looking for a site across the state for the COVID vaccines, you can also look and see where we have the flu vaccines up there as well. Thank you.
Thank you, Doctor. Secretary Bill Crouch with the DHHR is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, good morning. Thank you for taking my question. I'm covering the House today, and the governor's bill for medical exemption and religious exemption has been referred to the House Committee on Government Org. But I have a question about the religious exemption. The governor states that it's the law of the land and that we'll follow it, but it doesn't apply to the other immunizations in West Virginia. West Virginia famously is one of only 2 states in the country which does not allow for medical exemptions on school-age vaccinations. And he went through, many of them: polio, diphtheria, rubella, etc. And you talk about they've been weathered and through the test of time. We trust them. COVID, though, is relatively newer. And so the question is, are we making exemptions for COVID because of science or because of political expediency? And maybe Dr. Marsh can handle this. Doctor, either the COVID vaccine is safe, just like the measles and rubella and mumps and all the others, or we should have concerns about it. And if we don't have concerns about it, then why are we allowing religious exemptions where we don't allow religious exemptions for school immunizations? I guess I'm confused about it. And if you could help clear that up for me, maybe Dr. Marsh is the person, I would appreciate it. Thank you.
Well, I'll try it, Kenny. The bottom line is, without any question, the measles, mumps, rubella vaccines have been around a long, long time. And we know that we're in our infancy, in regard to the COVID-19 situation. Within that, we also know that and I've said this so many different times, fragmenting in every direction is not West Virginia. It's not what has absolutely pulled us through this entire thing. Now, we absolutely know that we need, at least I believe, at some point in time, you got to do things that are not very popular, but I believe that our freedoms and our rights as people make us who we are, and this invasion in a lot of different ways of, a socialistic movement or whatever like that, that's not me. And Kenny, you always just want me for who I am and who I stand for and the truth. I do have conservative values. I work with logic. I try to strike a balance between, all that is going on within our businesses, our people, and different things. You know me to be the guy that speaks the truth. Well, I can tell you that in my heart, I firmly believe that we're combating this terrible killer to the very best of all of our abilities. And with that, if you just follow that logic and just say, well, hold on here. Is it really fair for us to step out and you know, someone that truly has a real medical reason to not be taking this, or someone that has a real religious belief in everything, that from their standpoint, they absolutely do not feel comfortable taking this vaccine. Do we really want to mandate out of the Constitution on something that we, even though we absolutely believe is incredibly safe, we do not have the test of time that we do have with the measles and mumps and rubella vaccines? We don't. Now, I'm going to stand rock solid in telling you over and over and over to get vaccinated, because I believe it's just that safe. But from the standpoint of imposing, you know, a will that is beyond, you know, what I consider our freedoms and our Constitution, I'm not for that. I'm not for that at all. You know, I think we still need more and more and more education as we go forward. There'll be, over the test of time, over the decades to come, we'll look back on the days of COVID, and I'm sure that we'll have some adjustments in what we thought was right. Maybe it wasn't exactly right. But nevertheless, from my standpoint, I still stand rock solid by just what I'm trying to do. That's just clarify, just clean it up. I truly believe that if we're going to follow our military or whomever it may be, we need to have exemptions. We need to be tolerant to exemptions, because that's our rights, and that's how I see it, you know. And so it may not be what everybody likes. I'm sure it can't be, but that's how I see it. And I'm doing everything in the world, the very best I can possibly do all the time to keep us together. I'm not doing the best I can do to keep us together from the standpoint of making the right political moves. I'm not doing that in any way. This may not be very popular, and that's all there is to it, but at the same time, I do think in my heart this is the right thing to do. And I hope and pray that we're doing it at a time when the surge is moving our way, and I absolutely believe that it is the right thing to do. We don't need to lose people all across the state. We don't need people losing their jobs right and left and everything, and lose people across this state. You know, we need to, but we need to absolutely just do this. We need to let our businesses rule the day, but at the same time, I truly believe that they need to have some level of exemption, you know, exemptions within what they're doing.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Since the press conference started, WV Medicine has put out a statement saying that they oppose this exemption bill in its current form. Their statement says, "We would urge the legislature to push the pause button and work with key stakeholders and employees across West Virginia to ensure this bill does not unintentionally derail their efforts to protect their employees and the broader public." So, Governor, I was hoping you could respond to that. And then could you tell us who did you work with in developing this bill? Thank you.
Well, Charles, I've worked with everybody, but I didn't get who was opposing this, you know.
It's a statement from WVU Medicine.
Okay, I've not seen that, you know, and so Charles, I don't know how to you know, comment on that, except, you know, that I think that they already have exemptions that are in place and everything, but I don't know exactly what their objection is and everything, but I'll get into it. But Charles, you know, we've been through this with everybody. There's no point in just trying to list who the people we're consulting with and everything. We're talking to everybody.
All right, thank you, Charles. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everybody. Governor, I know you're a sports fan, and you're maybe as perplexed as I am when you look at the big crowds at World Series and college and pro football games, and you would think that they may be super spreader events, but because you have a bunch of people out there, a lot without masks on, a lot screaming their head and projecting whatever into the air, Does this prove that COVID is more of an indoor virus than an outdoor virus? Maybe your personal opinion, and then go to the medical folks. Do we have any indication on contact tracing, whether there has been any spreading taking place during these events? Thank you.
Paul, you wouldn't believe it, but seeing those folks at these games and these sporting events or wherever it may be, in these enormous crowds, screaming their heads off and everything, spewing stuff all over the place and everything is a driver to me in lots of different ways. And let me just explain. I personally believe this, and I really do. If we're going to say that's okay, and I'm truly behind that's okay, because it is outside, and it is probably, well, we know, it's significantly more, at peril to be indoors. We know that. And that's outside. However, if we're going to think that's okay, from the standpoint of just saying, that we're going to have mandates that, that says, that ABC person or whatever like that can lose their job or whatever, and maybe they have a really strong feeling, from a standpoint of a medical component or a religious component, not just anybody and everybody, but a real strong feeling, and they lose their employment, maybe even leave West Virginia. You see, Paul, it's hard for me to turn the television on and see people wall to wall, and then at the same time think it's okay for someone who really believes within their mind, and they have religious rights or surely medical rights, and absolutely just turn their back on them. So Paul, your question to me, as your governor, really hits home, because I've thought about that over and over and over. That's why I'm trying to clean this up. That's why I'm trying to really thread the needle and be really fair, just fair, and very, very hopeful that we are on a decline. But if we're willing to accept the football stadium, it seems to me like it is difficult for me to accept it's okay for us to turn our back on people that are losing their jobs that have a legitimate reason that should fall in the exemption category. That's my feeling.
All right, thank you, Paul. Next, we'll go to Mark Curtis with Next Star Media.
Good panel. I'm in the elevator at the Capitol. I hope you can hear me, but I'm wondering if the doctors, Marsha or Amjad, could explain what the most common medical exemption would be, what they expect to see most often from the medical exemptions. And maybe Kenny asked this, but will this expand the exemptions to all other required vaccines like mumps, rubella, measles, etc.?
Well, let me say this, Mark. First of all, get out of that elevator. I mean, honest to goodness, boy, you talk about a ride. I got in the elevator over to Mansion. I was going up to living quarters and everything, and got in the elevator and hit the button and everything. It didn't go very far, and then there I am. And you talk about, I'm not claustrophobic at all, but when you're in that elevator to Mansion, which is not much bigger than I am, and it got really hot. And I was in that elevator for probably 30 minutes, and the state police and everybody in the world trying to get me out of that elevator, and they couldn't do it, from the standpoint of a crowbar and everything else. And if I had been Kathy, and Kathy was caught in it for, I don't know, a minute or two, but she wasn't in it like I was caught in it and everything. But you go through that for 30 minutes, and if it was Kathy would have been a basket case. a total basket case. So I'd say get out of that elevator. That's all there is to it. You know, that's the first thing. But the other thing is, in my world, you know, mumps, measles, rubella, if we could just use that as an example, the test of time, decades and everything, it's a different animal. It's an entirely different animal. I think today, you know, we make these exemptions in the COVID world and everything and move forward. Would that affect the exemptions towards, you know, exemptions rather towards mumps or measles, mumps, and rubella? No way. But nevertheless, that's the best answer I can tell you. And the follow-up is get out of that elevator.
All right, thank you, Mark. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. My question is for the governor. I'm going to go back to the legislation that you proposed, and specifically to schools. So, you know, as written in the legislation, it just uses the word school. So when I read that, I'm interpreting that as not only K through 12, but also secondary. I'm also reading it as not just public, but private, and that this would be in effect for, you know, indefinitely. So I'm just wondering if you could confirm that kind of I'm reading it the right way, or let me know if, no, you're actually intending this just for public schools or just for K through 12. Thank you.
June, thanks a bunch. And I'm going to let my general counsel answer that because he's the guy that drafted a lot of this. And if we have anybody to blame, you just blame him.
So that's right. If anyone's to blame, it's me. But I think the version you're looking at, June, is an older version. The version that was filed with the Secretary of State and the clerks does not have that provision in it. So I think you're just working from an earlier draft.
All right, thank you, June. Next, we'll go to Brendan Tierney with WSAZ.
Good morning, Governor and panel. I have two questions today, one for the governor and then one for Dr. Marsh. Governor, I'd like to start off by reading something you said on Monday. This is a quote from your statement during your press briefing. You said, quote, "We should not be trying to tell private businesses what they should do or what they shouldn't do. With all of that, we should stand rock solid in our beliefs against mandates, and we shouldn't be mandating that a private business's decision should be." So that was your quote from Monday. So if I understood what you were saying correct today with this proclamation you're releasing, you're saying that you're not looking to ban mandates for private businesses, but by saying businesses must offer exemptions, you are banning that these private businesses can have mandates. Would you agree that this is a slippery slope, and when everyone's allowed to either get a doctor's excuse or religious exemption for things like what you said, just feeling uncomfortable with getting a vaccine, when there is kind of an end in sight to this possible slippery slope? And the second question for Dr. Marsh, did you consult with either the governor or WVU Medicine before this proclamation was issued to add this bill? And what's your stance on the statement that WVU Medicine released this morning?
Okay, Brendan, let me tell you this. In talking with legislatures and talking with lots of different folks, I felt like that it was proper to clarify, to say we're changing horses in the middle of the stream here. No way. I believe just as strongly that our businesses should have the right. Because they're private businesses, they should have the right to mandate, if they choose to mandate. I think, even though I'm surely not big on mandates, but if they choose, it's none of my business what they do. But if they choose to mandate that their employees should be vaccinated, that's fine and dandy. But, Brendan, here's all there is to it. We need to follow the law, do we not? I mean, we need to follow the law, and that's all I'm trying to do is just clarify from that standpoint. Now, from from the standpoint of waiting until the federal government releases, whom those exemptions and how they ought to all fall into place and everything. Well, we'll see what happens there. But Dr. Marsh is going to answer, another part of the question and everything. Brendan and Dr. Marsh, please.
Thank you, Governor, and thank you, Brendan. In my role in helping the state with its response to COVID-19, certainly the governor has been clear about the goal of keeping the state together, pulling the rope in the same direction. And certainly as he considers what's best for the state, we are fully supportive of recommending medical and scientific and operational details for him to decide and help direct us. Related to WVU Medicine, certainly I do play a role in WVU Medicine at the Academic Health Center, which is my day job. But certainly as there are policy decisions that organization has questions about, then that is generally more related to West Virginia University Hospital System, which Albert Wright is the CEO, and the board that governs that. So certainly we all want people to get vaccinated. We all believe that the way that we're going to resolve the COVID-19 crisis is more people getting vaccinated, being protected, fewer deaths, fewer transmission that will last much longer, with the vaccines being updated with boosters, et cetera. So thank you.
All right, thank you, Brendan. Governor, I'll turn it back to you.
My chief of staff just said something, but okay. Let me just, again, in trying to just make some notes and everything, I do want to follow up, General Hoyer, his thanks to all those that are helping, the vets at the VA hospital in Clarksburg. That's we should absolutely, again, I don't know how many times I've said this, but those are the very people that have given us everything that we have, and we ought to try to help in any way, in every way we possibly can. I know the big news of the day is to clarify, what I think, should be exemptions, from the standpoint of, allowing people that have strong or have a medical condition or strong religious beliefs and everything in regard to the vaccines. And it's driven a whole lot by lots of different things, but first and foremost, it's just how I believe and what I think. But on top of all that, you do see all the folks that are at our football games or wherever it may be. That has an impact just from the standpoint of, it just seems like if someone strongly in their heart has a religious belief or a medical condition and everything, to dismiss them from their employment, that seems like it is outside the bounds of the law, and we should absolutely follow the laws. I continue in every way to encourage everyone to be vaccinated without any question in all the world. We all know how safe the vaccines truly are. And I'd end up by just saying this, and this is ever so true. It is amazing the job that these experts that are on the panel and everything all the time are doing. I get information from them through all kinds of different channels on what they're doing every day. It is amazing what they've done, and I could never be any more grateful. One thing that I think Dr. Marsh said, it was Dr. Marsh that said this earlier, and I'm a little off in the numbers, but he said, in West Virginia, we don't have the hospitalizations of our kids like is true maybe in other states. But yet we have, I think he said, 15 kids that are hospitalized today. He may have said there's 5 in the ICU units and 2 on ventilators. Well, just think about it, really and truly. I know we can't bat 1,000. I know we can't have no kids that are involved in this dreaded killer, but really and truly, that's what we should strive for. You know, it is 15, if the number was 15, but 15 of our kids hospitalized and 2 of them, of all things, on ventilators. Can you just imagine? Can you imagine what those families are going through? I don't know how in the world it could be any worse. And so I encourage you with all in me for our kids to get vaccinated, because we know these vaccinations are safe, and I encourage you in every way. But I will stand for our freedoms, and I will stand for the law. And so with all that, you know, I know that with some it may not be a popular decision, but absolutely I think with all in me that what made this state great, what makes our nation great, is our freedoms and the law. And so with all of that, I'm just trying to clarify, and I ask for your prayers, especially for all these that we've lost, but even more so for all those kids that are hospitalized right now. And so, anyway, again, I thank everyone in every way, and they're giving me a little update on this. They're saying that there's 6 kids that are hospitalized, and 2 in the 3 in the ICU units and 2 that are on ventilators. So I may have gotten it a little bit wrong on the numbers, but you know, it just hits home with me like crazy to just think what in the world those families are going through to be looking at their children on a ventilator. It just, I don't know how, it's just